Quick heads up before we start. This isn't one of those videos that promises to magically double your revenue while you sip coffee and do nothing. If your clinic is generating leads but not turning enough of them into booked patients, the issue usually isn't demand. It's follow-up, speed, and consistency. The unsexy parts of growth that actually matter. Most clinics don't lose revenue because they lack leads. They lose it because staff is busy, calls get missed, follow-up is inconsistent, and opportunities quietly slip away. What you're about to see is an AI-powered patient acquisition system designed to fix that problem. Not by replacing your team, but by supporting them. It generates demand, follows up instantly, qualifies patients, and books consultations. So your staff can spend less time chasing leads and more time doing the things only humans should be doing. Here's the reality most clinic owners eventually run into. Growth doesn't stall because marketing stops working. It stalls because the systems behind the marketing can't keep up. Front desks get overwhelmed. Follow-up becomes reactive instead of intentional. Calls get missed. Messages sit unanswered. And by the time someone finally reaches out, the patient has already moved on. This is why so many clinics blame lead quality, when in reality, the issue is timing and consistency. Patients don't wait. They book with whoever responds first and follows up best. The obvious solution seems like hiring more staff, but that introduces a new set of problems: higher costs, training time, turnover, and more management overhead. And it still doesn't guarantee speed or consistency. These bottlenecks don't show up on a P&L right away, but over time, they quietly limit how much revenue your clinic can actually capture from the demand you're already paying for. This is where patient acquisition is either won or lost. When someone raises their hand and inquires about treatment, they're actively comparing options. They're not waiting, they're shopping. The clinics that respond first don't just get the conversation, they set the frame, they earn trust, and they control where that patient books. The problem is, most teams can't respond at that speed consistently. Not nights, not weekends, not during busy clinic hours. This system solves that gap by responding instantly every time, without depending on staff availability. Speed doesn't just improve conversion, it prevents your leads from ever becoming someone else's patients. Before a system like this is in place, most leads don't disappear because they aren't interested. They disappear because life gets in the way. Patients submit an inquiry while they're at work, with family, traveling, or in the middle of their day. When the clinic calls once and doesn't connect, that doesn't mean the lead is bad. It just means they weren't available at that moment. The problem is that, in most clinics, that's where the process stops. One missed call, maybe one follow-up, and then the lead quietly dies. Not because the patient didn't care, but because no system was in place to keep the conversation going. Not every lead is ready to move forward immediately. That's normal. But enough of them are. And many more would be if they were supported properly through follow-up and education. Now imagine a different scenario. Every lead gets a response immediately. Not when someone has time, but when the patient is actually paying attention. Follow-up doesn't depend on memory, sticky notes, or busy days. It runs consistently in the background, the same way every time. Patients get answers, guidance, and next steps without feeling chased or pressured. And by the time your team steps in, the conversation is already warm and informed. This isn't about replacing staff. It's about removing the chaos from follow-up so your team can focus on consults, patient care, and closing the right opportunities. That's what happens when lead handling runs on a system, not staff availability. This is the core of the system, what we call the AI concierge. Its job is simple. Make sure no lead is ever forgotten, delayed, or dropped just because your team is busy. The moment a lead comes in, the system begins outreach automatically. Calls, texts, and follow-up. And it keeps going until that person either books a consultation or clearly opts out. That persistence is where most clinics lose revenue today. Not because the team isn't capable, but because consistent follow-up at scale is nearly impossible to do manually. By handling the majority of that work automatically, the system increases conversions without increasing ad spend and without adding more staff to manage. Your team only steps in when it actually matters, when a patient is engaged, informed, and ready to have a real conversation. The result is a more predictable pipeline, less operational chaos, and a consistent patient experience every time, day or night. Here's how the system works in the real world, not the fantasy version. We generate demand through Google and Meta. Google captures people actively searching for a solution, which usually means higher intent. Meta captures interest earlier, which means curiosity, research, and yes, a few tire kickers. And that's normal. We don't have a way to read someone's mind when they submit a form. If we did, we'd probably be selling that instead. What the system does is sort this out over time. Follow-up starts immediately through calls and texts. Leads who are responsive and motivated get prioritized and moved forward. Leads who aren't ready yet don't get thrown away. They're placed into longer-term follow-up so they're still supported and reached when timing is right. As conversations happen, intent becomes clear. The system qualifies interest, answers common questions, sets expectations, and escalates the right people to your team. By the time a consultation is booked, your staff isn't guessing. They're speaking with informed, engaged patients who are actually ready to talk to a provider. Your team stays in control. The system just handles the parts humans aren't great at doing all day, every day. Consistency, prioritization, and perfect timing. This is the part where we set expectations and save everyone a lot of frustration later. This system is designed to support your team, not replace ownership, sales skill, or good operations. If something claims it can do all three, it's probably also claiming it can fold laundry and walk the dog. What this is a system that takes the repetitive, time-consuming parts of lead follow-up off your team's plate. It improves speed, consistency, and persistence. The things humans are notoriously bad at doing perfectly, all day, every day. What this isn't is a replacement for a closer. It's not a revenue guarantee. And it's definitely not a turn it on and disappear solution. Think of it as infrastructure. When it's paired with a real sales process and a team that knows how to run consults, it helps you convert more of the leads you're already paying for, without adding more chaos to your operation. When this system is paired with a strong sales process, consistent follow-up, and a team that knows how to close, the results can be significant. The AI handles what most clinics struggle with. It actually answers the phone, responds instantly, and follows up persistently so real opportunities don't slip through the cracks. In ideal conditions, strong demand, disciplined execution, effective closing, and ongoing optimization, some clinics may be able to generate up to $100,000 per month in revenue using this system. That said, this is not guaranteed and definitely not automatic. If it were, we'd all be retired on a beach somewhere, and this video wouldn't exist. The system handles speed, consistency, and persistence. Your team focuses on what humans do best: building trust, educating patients, and closing the right conversations. Quick clarification before we go further. This isn't just a follow-up tool duct-taped onto your existing marketing. Lead generation is built in. We run Google and Meta campaigns designed for high-intent medical searches, people actively looking for solutions, and route those leads directly into automated outreach. The landing pages are already tested and optimized for consult bookings, so we're not guessing what works. For video, we don't send film crews or actors. Instead, we provide proven scripts that your team records right on a smartphone. These scripts have already been tested across markets, and once recorded, we professionally edit and deploy them into your campaigns. The result is ads that feel personal, build authority, and actually look like they came from your clinic, not a stock library. Then everything gets continuously optimized, ads, pages, and follow-up, based on real booking data, not vanity metrics. So instead of juggling vendors and wondering where things broke, you get one system designed to generate demand, respond fast, and convert more of the leads you're already paying for. Let's be honest for a second. This system isn't for everyone, and that's intentional. If you believe every lead is a bad lead just because they didn't buy after one phone call, this probably isn't a great fit. If you expect every lead to answer the phone the very first time you call, while they're at work, with their kids, or putting out a small life fire, same thing. If you don't believe in consistent, multi-touch follow-up, or think one attempt counts as doing your part, this system will feel unnecessary. And if you're unwilling to use or refine sales scripts to improve consult quality and close rates, this won't magically fix that either. This system is built for clinics that understand patient acquisition is a process, not a single moment, not a single call, and definitely not wishful thinking. If that sounds like you, keep watching. If not, at least we saved each other some time. When clinics put all of this together, the ads, the AI follow-up, and the CRM actually working as a system, a few things consistently happen. First, they book more consultations, not because demand magically appeared, but because leads that would have slipped through the cracks are finally being contacted, followed up with, and guided to the next step. Second, speed to lead improves dramatically. Leads are contacted in seconds, not hours, which, as it turns out, matters when you're dealing with real humans and real schedules. Third, clinics see a higher return from the same ad spend, same traffic, same budget, better follow-up, better results. And finally, staff pressure drops. Front desks and coordinators spend less time chasing unanswered leads and more time focused on patient care and real conversations. No silver bullets, no magic tricks, just fewer missed opportunities. At this point, you can already see the pricing. And if you're pausing to think about the investment, that's exactly what smart operators do. The key is understanding what this replaces. Most clinics are already spending far more than they realize trying to build something like this internally. It's just spread out across people, tools, and vendors. Let's look at the real numbers. A single patient coordinator or lead manager typically costs $5,000 to $7,000 per month once salary, payroll taxes, benefits, and time off are factored in. That's $60,000 to $80,000 per year for one role. Hiring adds even more. Recruiters and staffing agencies often charge $5,000 to $15,000 per hire, and that cost repeats every time there's turnover. Then there's software, CRM, texting, calling, call tracking, scheduling, reminders, reporting, and integrations. Most clinics are paying $1,000 to $3,000 per month, or $12,000 to $36,000 per year across multiple platforms. Marketing is usually separate. Agencies for Google, Meta, landing pages, and creative often run $3,000 to $6,000 per month, and they're rarely responsible for follow-up or conversion. When you step back and look at it monthly, clinics trying to do this themselves are often spending $10,000 to $15,000 per month. On a yearly basis, that's $120,000 to $180,000 per year. And even then, important pieces are still missing. Now compare that to this system. One monthly investment that replaces fragmented staffing, multiple tools and multiple vendors. It answers calls, it follows up instantly and consistently, it qualifies and books, and it runs whether your team is busy, short-staffed, or offline. So this isn't about adding another expense. It's about consolidating spend, recovering wasted ad dollars, and removing the operational drag that slows growth. For clinics that think in terms of leverage, efficiency, and opportunity cost, the comparison becomes very straightforward. If you've made it to this point, congratulations. You've just finished the demo, and hopefully it felt refreshing. No waiting days to talk to a rep, no small talk, no hour-long call where someone asks questions just to turn them into a sales pitch. You were able to see how the system works, what it does, and whether it makes sense on your schedule. At this point, you know how it helps reduce wasted ad spend, save staff time, and turn more interest into actual patient conversations. So if this feels like a fit and you'd like to see what next steps look like or ask a few specific questions, the next step is simple. Schedule a call. It's a focused conversation to confirm fit and walk through implementation. Nothing more. Thanks for watching, and we'll connect if and when it makes sense.